Hi guys! For my presentation, I am going to focus on narcissistic personality disorder, or NPD, and understanding the complexity and the impact of it. Narcissistic personality disorder, NPD, is a complex and often misunderstood mental health condition marked by a pattern of grandiosity, an overwhelming need for admiration, and a noticeable lack of empathy. While society often uses the term narcissist colloquially to describe someone self-absorbed, NPD goes beyond vanity or arrogance and can significantly impair social, occupational, and interpersonal functioning. According to the DSM-5, approximately 0.5 to 1% of the general population may meet the diagnostic criteria for NPD. This presentation I am doing is going to explore the symptoms, the causes, consequences, and treatments of NPD with attention to both psychological theory and clinical practice. Narcissistic personality disorder is defined in the DSM-5 as a pervasive pattern of grandiosity in fantasy or behavior, a constant need for admiration, and a lack of empathy beginning in early adulthood and present in a variety of contexts. To meet the diagnosis, an individual must exhibit at least 5 of 9 specified traits. These include a grandiose sense of self-importance, preoccupation with fantasies of unlimited success or beauty, belief in being special and unique, need for excessive admiration, a strong sense of entitlement, interpersonally exploitative behavior, lack of empathy, envy of others, or belief that others are envious of them, and arrogant behaviors or attitudes. Although people with NPD may seem confident, this often masks fragile self-esteem and hypersensitivity to criticism. Studies have shown that beneath their grandiosity, individuals with NPD often experience shame, insecurity, and chronic feelings of emptiness. One example from clinical observation is the tendency of patients with NPD to react with intense rage or withdrawal when faced with failure or rejection, known as narcissistic injury. The etiology of NPD is multi-phase and likely involves genetic, neurobiological, environmental, and psychological components. There is growing evidence that personality disorders, including NPD, may have a genetic basis. Livesey found significant heritability in personality traits associated with narcissism. Additionally, neuroimaging studies by Scholz revealed abnormalities in brain regions linked to empathy and emotional regulation, such as the anterior insula and prefrontal cortex. Childhood experiences play a crucial role in shaping narcissistic traits. Both excessive pampering and harsh criticism can create a distorted self-image. Horton emphasized that inconsistent parenting, alternating between overvaluation and neglect, can cause a child to internalize unrealistic standards for self-worth. As a result, the individual may overcompensate by inflating their self-importance. Cultural factors may also reinforce narcissistic behavior. Western cultures that prioritize individual achievement and competition over community and cooperation may unintentionally nurture narcissistic tendencies. Individuals with NPD often have a profound impact on those around them. In personal relationships, they may be emotionally manipulative, demeaning, or dismissive. Their need for admiration can lead to exploitative or one-sided partnerships, often characterized by emotional abuse or gaslighting. In occupational settings, people with NPD may excel in leadership roles, at least initially, due to their charisma and confidence. However, their poor tolerance for criticism and inability to emphasize can cause serious dysfunction in group environments. Navicka found that narcissistic leaders tend to hinder team collaboration and decision-making over time despite their self-assured demeanor. Moreover, when individuals with NPD attain power, their actions can affect entire communities or organizations. Their moral reasoning may be compromised, making them more prone to unethical or self-serving decisions. MPD often coexists with other mental health conditions, which can complicate treatment and prognosis. Depression, anxiety disorders, substance abuse, and other personality disorders are commonly reported. For example, when individuals with MPD face failures that challenge their inflated self-image, they may experience intense depressive episodes, sometimes referred to as narcissistic collapse. The long-term outlook for MPD varies. While some individuals show improvement in interpersonal functioning over time, especially with intervention, others struggle with persistent dysfunction. Early diagnosis and long-term therapy improve the prognosis significantly. Despite its challenges, MPD can be treated. However, treatment is complicated by the fact that individuals with MPD often do not perceive themselves as having a problem. Psychotherapy remains the most effective treatment. Cognitive behavioral therapy focuses on identifying and challenging disordered thought patterns, while psychodynamic therapy helps individuals explore the unconscious roots of their behaviors. Therapists often emphasize developing empathy, regulating self-esteem, and improving interpersonal skills. While no medications directly treat MPD, symptoms such as anxiety or depression can manage pharmacologically. Antidepressants or mood stabilizers may be prescribed when appropriate. Group therapy has shown promise in helping individuals with MPD learn from peers and receive feedback in a controlled setting. When paired with individual therapy, can improve social functioning and reduce harmful behaviors. Narcissistic personality disorder is a serious and often hidden mental health issue that affects not only those diagnosed but also the people and environments around them. Rooted in complex interactions between biology and experience, MPD presents unique challenges in diagnosis and treatment. Increasing awareness, reducing stigma, and advancing psychological interventions are essential to help individuals with MPD lead more adaptive, empathetic, and fulfilling lives. As clinical research continues to evolve, so will our capacity to treat and understand this complex condition more effectively. Thank you guys. Hope you like it.